2 minutes to 2. I see people are coming into the room, so we can probably start. Well, thanks to both of you being here. Let me start the afternoon session. So thank you everyone for being back here for this one-day symposium on male reproductive health, which is organized by the UPF Eugene Cathedra or Chair. And as the chair director, Professor Calafell, explained this morning, the aim of this chair is to, among other things, promote educational activities such as this one. And it is really a pleasure for me to be here for this afternoon session. We have 4 speakers of absolute international high quality. I'm very happy to be here with them. And so I would like to start by introducing the first speaker of this afternoon, Professor Christina Bergh. Christina is a professor of obstetric and gynecology at the Göteborg University in Sweden. But apart from that, and in addition to that, she is also a head of the National Quality Registry of ART in Sweden. And she's a very active researcher in the field of children follow-up after assisted reproduction, quality of care, or in general, many aspects that has to do with quality and safety of assisted reproduction. She has been supervising and mentoring several PhD students, and she has published very extensively both original publication and also reviews and systematic reviews and meta-analysis. Christina, it's such a pleasure for me to have you here and for all of us. I think my colleague Frances will now share your presentation. So you can take the floor and just tell us when to change slide. The floor is yours, Christina. Thank you.
Thanks, Rita, for your nice introduction, and thank you for inviting me to speak. Yes, I work in Göteborg, and I will talk to you about the children from ICSI children, or the children from subfertile fathers. So next slide. I have no conflict of interest. Next slide. Just a little summary where we are now in the world. We have 9 million, or more than 9 million, I would say, are children, and between 2 and 6% of the European birth cohorts are born after ART. Concerning ICSI, you remember that the first child was born in Brussels, 92, and the first birth after ICSI with testicular sperm were born the year after, 93. Next slide. Next. Just to remember you what still are the biggest problem, even if it's getting less, and that is, of course, the high multiple birth rate in many countries in the world. And a little shamingly, I think that the US has now passed Europe, because for a few years ago, it has always been the opposite, that US have a higher multiple birth rate than Europe. But as you see on this slide, the latest figures from the US are around 10%, and Europe are still up at around 14%. And it's very different, varying figures for Europe. In the northern part and Nordic countries and so on, it's low, while particularly in the East Europe it's high. But also in some countries, we have talked about that a lot in the AIM, in the ESHRE AIM committee, that is, it's high in, for example, Germany, above 20%. Next slide. Here is the distribution of IVF, ICSI, and cryopreservation cycle, also from Europe. And the green bars, the light green bars, are the ICSI, and you see that it has raised. It's a 20-year period here, and you see that it is very high. It's around 70% now, while the IVF, standard IVF, decrease accordingly. The cryocycle do increase, and the latest figure here is 2016, and it do increase even more. And this very high is also around the world. This very high frequency of ICSI is also mirrored around the world. And I think there are now several publications that ICSI doesn't help if you have a normal sperm and unexplained infertility and so on. But still, it's like this. Yes. Next. So my talk should be about the health of the ICSI children. So I will tell you shortly about the perinatal outcome, some about birth defects, neurodevelopment, general physical health, and reproductive health. Next slide. Again, back to some general slides. These are perinatal outcome from singletons. It's a mix of IVF and ICSI children. And I show this because it's anyhow a good development over time. If you see the first, this is systematic reviews. If you see the first systematic reviews from the beginning of this century, the odds ratio was between 2 and 3, and even above 3 for being preterm and a low birth weight. While you see for the latest systematic review from Queen 2017, the odds ratio has decreased to between 1 and 2. So there is a positive development concerning perinatal outcome in singleton from ART. Next slide. And this can be seen also from this our own study, our CONACTAS group, which is a collaboration between 4 Nordic countries. And we have a database in Denmark, in Statistics Denmark, where we have collected all children born from ART and spontaneous conception since the start and now up to 2015. And it's around overall more than 7 million children, and 160,000 something is from ART. Anyhow, if you look at the graph to the left, down to the left, and the straight blue line, it's the preterm birth for the ART singleton. And one can see that it has decreased around 50%, in fact, in this 20-year period, from 14% down to 8%. And this has not at all happened for the spontaneously conceived singletons, which is the dotted line. And next up in the right is the, well, I don't see it myself now. It's the, I should, no, it doesn't help. I think it's low birth weight, which has decreased in a similar pattern, and also intrauterine death and perinatal death has a decrease for the ART children, or for the ART singletons, in a very positive way. It was small for gestational age here in this slide, so this has decreased also from a 50% decrease during this 10-year period. Next slide. And if we compared ICSI then to IVF, I think in the beginning we all thought that ICSI might be something dangerous, that it might have bad effects on the children. But I think, in fact, the opposite has been shown. And this is one systematic review from our group again, where we compared ICSI versus IVF singletons and its preterm birth. And as you can see, the ICSI has a lower rate of preterm birth compared to IVF singletons. It's an odds ratio of 0.8, which is significant. And I think one wonder how can this be? How can this happen? And the explanation we think is that the ICSI mothers are healthy, while the IVF mothers have their infertility diseases, which might affect the outcome in a negative way. Next. This has been repeated in many systematic reviews afterwards. This is the latest, which is from Quinn 2017. And here again, you can see the ICSI are the dark blue bars. There is a lower rate of preterm birth, very preterm birth, low birth weight, and very low birth weight in the ICSI children compared to the IVF singletons. The only thing which is some worry is the birth defects, which was significantly higher here in the ICSI singleton. I will come back to that some later. Next. So here it is, birth defects then, which is a very important outcome, of course. You know, it's extremely important for the patients. It raises always concern if you talk about malformation. Anyhow, there has been consistently shown, I think, all from 20 years ago and up to now, that there is an increase in birth defects in children born after ART versus children born after spontaneous conception. It's somewhere around 30–40%, in some paper up to 70%, but around 1.4 as you see the odds ratio here. Next. And also this, our Konatas group has confirmed this in our latest publication. Overall, we found an percent of malformation, percent of birth defects among the ART children. The ART singletons here was 61,000 and 250,000 spontaneous conception. And so this was an adjusted odds ratio of 1.2, and it was a variety of different malformation. That's good, I think. That's not, it's only one specific malformation that you see an increase in, but that is not the case. It's all over the panorama with a moderate, I would call it, a moderate increase in birth defects among ART children. Next. Then ICSI compared to IVF. I think this is a little classical meta-analysis, which is now some years old, but included a lot of studies and 27,000 ICSI children, and they found no increase whatsoever in birth defects in ICSI compared to IVF children. Next. Anyhow, all science is that happens things all the time, so there are no fresh papers coming, and these ones from Australia, etc., they either didn't compare ICSI versus IVF. They all showed this higher in both ICSI and IVF compared to spontaneous conceived children, but some of them didn't compare ICSI versus IVF, and the other didn't find any difference. However, the latest Quinn, as I mentioned for you, they did find a significantly increased rate of malformation in ICSI compared to IVF, 8% versus 6.3%. Next. Yeah, and maybe you remember this Michael Davis paper, because it was published in New England some 8 years ago, and it was not a large study. In fact, it was only 4,000 ART children compared to spontaneously conceived children, and they also compared IVF to ICSI. Anyhow, what they found was on the screen, etc., quite highlighted, was this slight or moderately higher malformation rate in ICSI versus spontaneously, but also in ICSI versus IVF. Here is the other way around, that it's IVF versus ICSI, which is a lower rate, but it's you can translate it, of course, to that this was a higher rate of malformation in the ICSI children versus the IVF, and that was overall. And when you separated fresh and frozen, one saw it mainly in the fresh cycles. That might be a power problem. Of course, it was less frozen cycles. Next. Yeah, here was this Queen study then again, which come after this one, and that I've already shown you. Next here. Yeah, the one of the latest study is published this year. It's from US. It's Barbara Luke and her group, and you see it's a very big study. It's 135,000 ART children and more than 1 million spontaneously conceived children. And here, when spontaneous is referenced, you see the ART IVF, which is higher compared to the spontaneously conceived, with an estimate of 1.18. For the ICSI with non-male, its estimate is 130, and with male factor and ICSI, it's 142. In fact, they didn't do any comparison between, all comparison are to spontaneously conceived. They didn't do any comparison ICSI versus IVF, but still they conclude that ICSI has a higher rate of malformation, and particularly ICSI with male factor has a higher rate of malformation. That's their conclusion. Next. This paper is from a guy called Waldwright, and it concerns birth defects and sperm origin. And it's not that many studies, but anyhow, they didn't find any differences between ejaculated sperm, epididymal sperm, and testicular sperm concerning birth defects. Next. Well, more people has digged into this, and I think we all were mostly worried or about genitourinary birth defects, because that was we have suspected and maybe seen in the first publication, the oldest publication. And in this meta-analysis, including 9 studies, they did found a higher rate of genitourinary birth defects among the ICSI children. However, when they limited their analysis to studies with low risk of bias, this was just on the borderline. For these particular diseases or this particular malformation, hypospadia and cryptorchidism, anyhow, they could not detect any significantly raised increase. Next. Our own group again, Conactas, have an ongoing study on this, but it's not published yet. I just show it that it's big figures. You see, it's 51,000 ICSI children, 82,000 IVF children, and 6 million controls from these 3 countries. And for any birth defects, we saw, as expected, an increase in the ICSI versus spontaneous conceived children, but also a slight increase in the ICSI versus IVF. I don't show you the pictures because it's not published. Next. Concerning chromosome analysis, all since the start, I think, of ICSI from the Brussels group and so on, there has been a huge number of chromosome analysis papers, small studies mainly without controls, etc., and very difficult for the reader, so to say, to dig into this and see, is there an increased rate or what's going on? So we did in our Nordic as well, a paper just published a month ago in Human Reproduction Update, where we checked for a possible association between ICSI and chromosomal abnormalities. And you see, we found almost 5,000 papers, but we could only include 19 in our meta-analysis. And I give you the conclusion from the start here, and will show you the evidence for that next slide. But here you see that the conclusion is that it's uncertain if ICSI is associated with an increased rate of chromosomal abnormalities versus IVF, and also versus spontaneously conceived children, and that the evidence for this is very low. Next slide. And this is based on the meta-analysis we have done. Here, the first meta-analysis is with adjusted estimates. And you see that the diamond here crosses 1, so there's no significant increase in the adjusted analysis in ICSI versus IVF. We couldn't detect that. However, if we checked studies with unadjusted risk estimates, which of course is much lower quality, or what you should say, I mean there could be difference in maternal age and differences in history and different in parity, etc. And there, anyhow, in the adjusted analysis, there was an increase on 142 for ICSI versus IVF in any chromosomal abnormalities. Next. And this slide shows ICSI versus spontaneous conception. And here it's the same pattern in the adjusted analysis, no effect, no increase in chromosomal abnormalities in the ICSI children, while in the adjusted analysis there was an increase. It's so small, I can't see it, but I think it's somewhere between 1 and 2, 1.5 something increase in abnormalities in unadjusted estimates. Next. So I will turn to a long-term follow-up and give you some data on growth, cognitive and psychomotor development, mental disorders, autistic disorders, school performances, cancer, metabolic risk, diabetes mellitus, and puberty development. So next. Concerning growth, there are only few and small studies up to the age of 12, and one can say that one found no differences in either height, weight, or head circumferences in ICSI, IVF, and spontaneously conceived children. So that's reassuring. Next. Cerebral palsy is another very sensitive, very important outcome, I think. Also, of course, very important for the parents. I think in the first papers, here it's not ICSI only, here it's IVF as a whole. In the first papers which was published, they all came from the Nordic countries. One saw an increased rate of cerebral palsy among the ART children. Here it's both multiples and singletons, but you see that also in the singletons, one found an odds ratio of 182 in these Nordic studies. Next slide. Repeating these studies, it's in fact the same authors, now with a little bigger population, and they also adjusted their odds ratios, then the significance disappeared. But I think one can be a little critical to this adjustment. They adjusted for gestational age here, for example, and then you sort of take away the effect of ART on preterm birth, because we all know that ART is associated with a higher rate of preterm birth, also in singletons. Next. This paper is published just a week ago, I think. It's from the Konatas group again. It's published in Human Reproduction, and it's a trend over time in cerebral palsy. And I think it's a very important paper. First, it's a huge population. It's a register study in a huge population, 97,000 IVF and ICSI children, and almost 5 million controls, and it covers the year 85 to 2010. And so here is the time on the x-axis, and here is the prevalence of cerebral palsy. And the ART graph is this one. It's a little up and down, but the pattern is anyhow down. So that's the ART children, and it follows quite well the rate of preterm birth and multiple birth, and that's this line, these blue dotted lines. This line is the spontaneously conceived children. And this is also a slight going down, but not at all as much as the art. So if one put figures to this, one can say that for all art children together in the beginning of the area, that's somewhere here, there was a higher rate of cerebral palsy among the art children, while in the end of the area, this was not. This was just on the border significant. If you go to the singletons, it was the same. There was a higher rate of cerebral palsy among the art children. But if you go to the other end of the time period, this was not significant any longer. And in fact, in total, it was not significant. And this is, of course, due to this decrease in multiple birth rate and preterm birth. So it's just published a week ago. Next. One word about imprinting. These imprinting stories are so difficult to catch because they are so seldom occurring. It's the four which one usually talk about is Beckwith-Wiedemann, is Angelman syndrome, Silver-Russell syndrome, and Prader-Willi, and they do occur in 1 on 30,000 or even less, 1 in 300,000. We wrote a paper concerning more general paper concerning art and imprinting some years ago. Next. There come at least 2 systematic reviews checking for imprinting disorders in art, and both has found an increased rate in the art children. Here it is Beckwith-Wiedemann syndrome with a relative risk of 5.2. And here it's any imprinting disorder with a relative risk of 3.67. In this paper, they found no association with Angelman, Prader-Willi, or Silver-Russell, only Beckman-Wiedemann. But again, most studies, including in these systematic reviews, are case-controlled studies, and you know, case-controlled studies are not the best evidence for making conclusion. Next. General physical health. These studies are quite old now, but we took part, Göteborg and Denmark took part in prospective studies. In fact, we investigated these 5-year-old ICSI children. The first study was a collaboration between Cornell, Brussels, and Göteborg, and the second was a collaboration between Brussels, UK, Denmark, Greece, and Sweden, which was some larger. We did investigate all these children and found very little differences, I would say, no major things. Here it was some more surgical intervention and some more physiotherapy. And in this one, a similar slight increase in some childless disease and requiring surgery. No difference between ICSI and IVF. So it was quite reassuring, this data. And this is a registry study from Denmark with no difference in hospitalization and surgical procedures. And the last here is from the Netherlands, which is where they investigated children and didn't find so much or no differences. Next. Metabolic health, how about that? Well, concerning ICSI, I think I only found these two from Brussels. It's Florence Belva, who they have checked their ICSI children in many ways. And here they checked them and compared them to the spontaneously conceived and could see that there were no differences in body composition or blood pressure, but they found some more obesity in the ICSI girls. In the next study, which is a little older adolescents, you can call them, and it's a bigger group. they found some differences in lipid levels, lipid concentrations, serum lipid levels. Otherwise, no differences between ICSI and spontaneously conceived peers. Next. So we go to autistic disorders. This is a systematic review from Australia, Alice Rumbold. It's included 35 studies. They found some conflicting results, and the conflicting is with the ICSI. So they found some more problems in ICSI children compared to both IVF and the spontaneously conceived. However, it disappeared when they adjusted for multiples, and they only found it in subgroups. Next. This is a Swedish study published in JAMA 7 years ago. It's a big study, 30,000 ART children and 2.5 million spontaneously conceived children with a follow-up of 10 years. Concerning autistic disorders, they did not find any differences overall in ART versus spontaneously, and not either in singletons, no differences. Next. They also investigated mental retardation, and here they did find some slightly more problems. You see the adjusted relative risk and the confidence interval. Here it is ICSI mental retardation in all ART first versus spontaneously conceived, and then it's in ICSI versus IVF, and then it's also ICSI surgical retrieved sperms versus IVF. So in subgroups, they found some more problems with mental retardation. Next. And also in this American study, this is a huge study from California, 42,000 ICSI children. And here it's IVF as a comparator, and they found an adjusted odds ratio of 1.65 for autistic disorders in the ICSI singletons. Next. Yes, it's just a more detail from this kissing study that it was the ICSI singletons versus the IVF singletons, and in fact also among the multiples a similar pattern. In fact, it was more in the without male factor infertility where these figures were significant. Next. School performances. School performances is a very good outcome, I think, because most people go to school. Here it is. Both IVF and ICSI first. 8,000 who has finished 9th grade. That's when the children are between 15 and 16 years old. And this is a Swedish study covering these 15 years, and 1.5 million controls. Next. The only message here is that we checked for total score in these children. We checked for mathematics, Swedish, English, and physical education. And overall, the ART children did better. They performed better, around 10% higher scores compared to the ART children. Next. But when we adjusted for relevant confounders, particularly the parents' education, the overall score was in fact slightly lower, but not clinically relevant. Otherwise, we found no differences. Next. Next. Yeah. And also in previous, I missed one. Also, qualifying to secondary school and poor school performance, we found no differences. In fact, we found some difference in the 3rd grade with lower score for the ICSI, but they had disappeared at 9th grade. Next. Here it's cancer. It's also a very important topic, of course, an important outcome. And there has now been published several large studies concerning cancer. Most of them have been negative. A large UK study with 100,000 ART children and a Swedish study and a US study with almost 300,000 ART children, where they just on the borderline an increased risk. The latest study was from Denmark. It's Hargreave, and here they separated for ICSI as well, and no increased risk in ICSI versus spontaneous. Where they found an increase was in the cryo babies, and that was summarized in this latest systematic review from Chang 2020. And nothing for IVF and nothing for ICSI, but a slightly increased rate for the cryo babies. Next. This is diabetes. It's also von Conatas, but it's the only Swedish data. Diabetes type 1 is a serious disease and affecting young children. The top age is between 10 and 14, so there was possibilities to catch that in our ART cohort now. The ART cohort consisted of 47,000 children, singletons, and the control of 3 million. And here we found 202 diabetic children, and that was a higher rate per 100,000 person year. But when you did adjustments for several confounders, there were no overall higher risk for diabetes among the ART children. There was a slightly higher risk. We did 2 subgroup analyses, a slightly higher risk among the cryo babies, both compared to the fresh and compared to the spontaneously conceived. Concerning ICSI, which is the topic for this lecture, we found no difference between ICSI versus IVF concerning diabetes type 1. Next. Lastly, reproductive health. These are also from Florence Belva in Brussels. They have investigated their ICSI children again, both boys and girls. And in this first study, they found, in fact, similar development in pubertal development. The only they did found was less advanced breast development in the girls at 14 years old. Next. And in some later, when there were some later, they also checked their sperm parameters. And in the boys, they did found some lower parameters, a lower total concentration and a lower total motile count. Of course, that might be expected because these first cohorts were born from fathers with a very severe male factor infertility. Concerning the women, no differences in reproductive hormones or mean follicular count. Next. So, summarizing, short-term outcome, perinatal risk decline over time in our children, very positive. For ICSI versus spontaneously, there is an increased risk, but ICSI compared to IVF, it seems to be a lower risk for the ICSI children. Birth defects, it is increased in the ICSI versus spontaneously, 1.2, 1.7. Between ICSI and IVF, maybe a slightly increased risk, as I've shown you now from several studies. Chromosomal abnormalities is a question mark, I would say. You saw these recently published systematic review where you in fact couldn't say that there is an increased risk for chromosomal abnormalities. Next. And last, and long-term outcomes then, we have no indication that cancer is increased in ICSI children. General health, I think, is reassuring. A little question mark for autistic disorders and mental retardation. Academic performance is reassuring. Reproductive health is mainly reassuring. Very little question mark for seminal quality. And last slide, thank you. Thank you.
Thank you.
Okay.
Yeah, thank you very much, Christina, for this very nice presentation, very comprehensive. We have a few minutes, actually very few minutes. If anyone would like to ask a question, there is the chat box that you see is the icon. So don't raise your hand, write in the chat, please, your question. But I would like to ask you myself while we wait for other questions to come in. So there is always, when we look at the outcomes of ART, the question if it is the ART per se or if it is the need of ART or the source of infertility that is the cause of this difference that we see. With ICSI specifically, across the year, what started off as a necessary procedure has become in many cases an elective procedure. So my question for you is, do you know if there are reports that compare elective versus necessary, and if these outcomes, do you expect to be different when we use ICSI but without a male factor?
Is your question if there is a difference using ICSI for male factor or non-male factor? Is that the question?
Yes, exactly.
I don't think there are so much big studies anyhow investigating this. What I first thought you were asking about was if it's the parent's characteristic or it's the technique, because that's another important question. And that has been investigating now in some these sibling studies where the mother has given birth to one IVF child or ICSI child and one spontaneously conceived child. And there are at least some data on perinatal outcome. And for perinatal outcome, in fact, it seems that both contribute, both mother's characteristic and the IVF technique contribute to the poorer outcome, poorer neonatal outcome. Yeah.
Perfect. Thank you. I see that there are, for now, no questions. So since we are really right on time, Christina, I would like to thank you for being here today. And I suggest